So this discussion is going to focus on aerobic endurance training programs and some of the physiology behind the adaptations that occur with this type of training. So some key terms, again, we're going to be looking at a lot of physiology, particularly with a lot of the chapters as far as just the adaptations that occur in the body. So your cardiac output, that's the amount of blood pumped by the heart in liters per minute. Okay, so and the two important factors here are your stroke volume and your heart rate, which that takes us to what stroke volume is. Stroke volume is the amount of blood ejected with each heartbeat. So each time the heart beats, it puts out a certain amount of blood. So the quantity that gets ejected each time the heart contracts to beat is your stroke volume. You multiply that by how many times your heart beats per minute, that gives you your cardiac output. Now there's two important mechanisms as it relates to stroke volume that kind of regulates how much blood it's going to pump out with each beat. You have the end diastolic volume, so that's the volume of the blood in the left ventricle at the end of diastole. So, diastole is when the heart's in between beats. So the amount of blood that's left in the left ventricle, because remember the left ventricle pumps blood out to the rest of the body. That's one of the mechanisms, and the other one is the amount of circulating catecholamines, epinephrine and norepinephrine. So both of those kind of regulate the stroke volume, obviously, because the norepinephrine is going to regulate how often the heart beats based upon the amount that's circulating in the body. So if we just look at the acute responses, so immediately what happens when you start, so say you go out and just do a low intensity steady state jog, for instance, what happens when you have, what's your acute response? So we look at the cardiovascular responses. Well, cardiac output. You go from rest to steady state aerobic exercise, your cardiac output initially is going to increase rapidly. And then kind of get more gradually, over time, it'll still increase, but then eventually you reach a plateau. So in other words, if you go out and just start, again, jogging at kind of what would be like a steady state, kind of low intensity, your cardiac output will rise pretty quickly. Then it'll continue to rise, but it'll kind of be a little more gradual. Eventually it reaches a plateau, okay? Now, if you start to, obviously, if you go out and you kind of do a little bit more of like a maximal exercise, your cardiac output could increase to almost 4 times your resting level. So again, it's all intensity dependent. Your stroke volume, your end diastolic volume is going to be increased significantly. So that's going to happen. And also at the onset of exercise, your sympathetic stimulation, so your sympathetic the sympathetic branch of your nervous system is going to cause an increase in stroke volume as well. Your heart rate is going to increase linearly with the increases in intensity, and that increase is going to be partially due to the Frank-Startling mechanism, which is going to increase the forced contraction of the heart. So that's going to impact stroke volume, but obviously your heart rate is going to be obviously going up in response to the intensity of the exercise. And then you have your oxygen uptake. So it's going to increase during an acute bout of aerobic exercise, and that's going to be directly related to the mass of the exercising muscle, your metabolic efficiency, and your exercise intensity, okay, is all going to be involved with your oxygen uptake. So those are your primary cardiovascular responses when you're looking at acutely what happens with aerobic exercise. So some more key terms is we look at what's called your maximal oxygen uptake. So that's the greatest amount of oxygen that could be used at the cellular level for the entire body. Okay, so that's going to be, in other words, how much oxygen your body can actually use, particularly when you're doing very strenuous activity. You have your resting oxygen uptake, and that's estimated to be around 3.5 milliliters of oxygen per kilogram of body weight per minute. Now, the importance of that, as we look at kind of measuring exercise intensity, is that value is defined as what we call one metabolic equivalent, or MET. Okay, so a metabolic equivalent looks at how much, again, oxygen your body is using. That's kind of the resting oxygen uptake that as standardized for everybody. as your activity level increases, so in other words, when you have different types of activity, you increase that metabolic equivalent because your oxygen uptake is going to increase. So for instance, riding a bike at a certain intensity may have a, maybe worth 4 metabolic equivalents, okay? And they actually have metabolic equivalents for different types of exercise, so it's one way that we could kind of regulate the intensity of the exercise and kind of know how much we're using. So continuing to look at now, we're going to look at acute responses to aerobic exercise, looking at cardiovascular responses. So first we're going to look at what occurs with blood pressure, but even before that, talk about what blood pressure is. So we know probably just everybody's had their blood pressure taken at some point. Blood pressure is essentially what enables, it's the pressure that the blood exerts against our arteries, and it allows things like oxygen and nutrients to help it perfuse through to our tissues and cells in the body. So we know that we have a systolic blood pressure and we have a diastolic blood pressure. So whenever you get your blood pressure read, for instance, you get your blood pressure taken, it might come back as 120/80. So what does that mean? So the top number is the systolic pressure. That's the pressure estimates that when the pressure exerted against the arterial walls as blood is ejected from the ventricular contraction. So it's basically the pressure that gets exerted as the heart is contracting, so during beats. Diastolic pressure is the estimated pressure exerted against the walls when no blood is being forcefully ejected through the vessels. So that's during relaxation, okay? So that's always why the top number is the bigger number, because that pressure is when the heart's actually contracting and there's actual blood being kind of forced through the vessels. I'll talk about in a little bit that how we kind of measure blood pressure and what is considered normal blood pressure. The standards have changed since the book was written, so I want to make sure that you have those new standards. The control of local circulation basically is going to be done through vasoconstriction and vasodilation of the vessels. So vasoconstriction means that the vessels, the diameter inside the vessels kind of decreases. Vasodilation means they get larger. So when you exercise, you need to have increased blood flow to the working muscles. So that means the blood vessels going to the working muscles are going to dilate, so more blood can get there because they need more oxygen to the working muscles. Meanwhile, for everything else, the blood vessels are going to constrict, so that local circulation is going to regulate that. So acute responses as it relates to aerobic exercise. So when we look at this, you get things like increased cardiac output, increased stroke volume, increased heart rate, increased oxygen uptake, increased systolic blood pressure, increased blood flow to the active muscles, and actually a decrease in diastolic blood pressure. So the diastolic blood pressure actually decreases. Now, I wanted to talk a little bit about and mention the new kind of what they consider for normal. So normal blood pressure, okay? Now again, these are the guidelines I want you to know. Normal blood pressure is less than 120/80, okay? So 120/80, less than that is considered normal. So the new standards, basically when you're between 120 and 129, and as long as the diastolic is less than 80, that's actually considered elevated. Okay, so that's considered an elevated blood pressure. Stage 1 hypertension, so when the blood pressure is too high, is 130 to 139/80 to 89. Stage 2 hypertension is a systolic greater than 140 and a diastolic greater than 90. Okay, so that's what you kind of look at as far as your hypertension guidelines are concerned and what's considered normal. Now you have to bear in mind as well that blood pressure could also be too low. So just having lower and lower and lower blood pressure is not good either. So hypotension or blood pressure that's too low is blood pressure 90 systolic, 60 diastolic, and lower. So obviously, if the blood pressure gets too low, you're not going to get oxygen and nutrients diffusing to the cells as well. So that would be a concern. Okay, so looking at some other acute responses, so now we look at the respiratory responses. So there's a significant increase in oxygen delivered to the tissue, particularly your working muscles and tissues in the body. Increases in carbon dioxide return to the lungs. Minute ventilation provide for appropriate levels of alveolar gas concentrations during aerobic exercise. Minute volume is the volume of air breathed per minute. And again, aerobic exercise provides the greatest impact on both oxygen uptake and carbon dioxide production as compared to other types of exercise, which would make sense because we're generating energy through the use of oxygen. That's the whole kind of premise behind aerobic exercise. So the picture here illustrates tidal volume. So tidal volume is the amount of air inhaled and exhaled with each breath. The slide shows the distribution of the tidal volume kind of around the within the respiratory area. So first to kind of look at, so the alveoli is where the exchange of oxygen and carbon dioxide takes place, okay? However, there's also other areas within the respiratory passages, so like the nose, mouth, trachea, bronchi, bronchioles. That area is not functional for gas exchange. That's called the anatomical dead space. Okay. The physiological dead space refers to alveoli that have poor blood flow, poor ventilation, or other problems that exchange gas. So the physiologic dead space in the lungs of healthy people is usually negligible because pretty much all the alveoli are functional. However, if someone has lung disease or something like that, there will be more physiological dead space. So this just kind of shows the kind of breakdown of kind of how air gets distributed. You obviously see the majority of it being the alveolar air. So the tidal volume comprises of about 350 milliliters of room air that mixes with alveolar air. About 150 milliliters of air are in the larger passages or the anatomical dead space, which is the space that doesn't exchange carbon dioxide and oxygen. So again, still looking at the acute responses, so respiratory responses. During higher intensity aerobic exercise, the pressure gradients of oxygen and carbon dioxide cause gases to move across cell membranes. And again, we're going to need that in order for our cells to get oxygen. The diffusing capacity of oxygen and carbon dioxide increase dramatically with exercise, which facilitates their exchange. So obviously there's going to be much more taking place. So during aerobic exercise, there's large amounts of oxygen diffusing from the capillaries into the tissues. So that's where that diffusion takes place. So again, primarily throughout our body, with the exception of one area, if you remember, our arteries contain oxygenated blood, our veins contain deoxygenated blood. The arteries lead to arterioles, which lead to the capillaries. That's where the carbon dioxide and oxygen take place. You also have increased levels of carbon dioxide move from the blood into the alveoli. Again, the alveoli is the part of the lungs where gas exchange takes place. And minute ventilation is also going to increase to maintain appropriate amounts of alveolar concentrations of the gases. So obviously we know that there's going to be an increased response as far as gas exchange taking place when we start exercise. This just shows the pressure gradient. So again, familiarize yourself with the anatomical structures that you're looking at in this. So the pressure gradients this shows the pressure gradients for gas transfer in the body at rest. So it's basically showing you the pressures of oxygen and carbon dioxide in the alveolar air. The venous arterial blood and the muscles are showing. So it's kind of also representative of what's going on anatomically just with circulation in general. So if you follow this, we're following blood leaving the heart, okay, so left atrium to the left ventricle to the body, systemic arteries. Here you're going to get your exchange at the muscles. You're coming back through the systemic veins, so you go through the capillaries, the venules, the veins, leads back to the right atrium, right ventricle, pulmonary artery to the lungs. The gas exchange takes place at the alveoli.